Hi, and welcome back to the Long-Term Forecast. I'm Dr. Denise Milne, Executive Director of the Alberta Continuing Care Association. I'm excited to welcome you to our 2-episode series on mental health in long-term care. Today, we'll discuss national strategies in long-term care homes. Don't forget to tune in next month for the follow-up episode, Mental Health and Medications in Long-Term Care Homes. Before we begin, I'd like to thank today's sponsor, Maxwell Management Group. I'm excited to welcome Heather Maxwell, President and CEO of Maxwell Management Group, to share more about her organization. With over 20 years of experience in executive recruitment, Heather specializes in building strong teams, creating effective recruitment strategies, and enhancing retention through positive organizational culture. With her extensive background in healthcare and seniors living, she has led Maxwell Management Group to become Canada's leading talent acquisition partner for the sector. Hi, Heather. Can you tell us a little bit more about Maxwell Management Group?
Hello, Denise, and thank you so much for having us today. We are so excited and we're very proud to be sponsoring this very important podcast. We are also very proud to be celebrating our 18-year anniversary of offering people and culture solutions to continuing care providers across Canada, including executive search, recruitment and retention, executive coaching, as well as education. We have been long-term advocates of the continuing care sector and the importance of health, human resources, and supporting the mental health of employees and those who work in and support the continuing care sector. When it comes to people and culture solutions, we have noticed 3 key trends over the last several years, and that is the regulatory landscape continues to change. Number 2, that there is higher resident acuity and an increased demand for services in long-term care and memory care. And number 3 is there's a decreased supply of talent. And when all of these 3 converge, it results in added pressure for leaders in the continuing care sector. During the pandemic, a survey indicated that nearly half of healthcare workers in Canada reported their mental health as somewhat worse or much worse compared to before the pandemic. Factors such as inadequate staffing levels, long work hours, and lack of training all impact. These statistics underscore the critical need for comprehensive mental health support and interventions tailored to healthcare workers to address these ongoing challenges. This is where our organization comes in and supports in relieving some of that pressure with unique workforce solutions. With our partnerships with the Gallup organization and Psychometrics Canada, our people and culture solutions are grounded in science. We offer safe and low-risk options that provide hiring authorities with peace of mind and deliver results that improve operations by enhancing quality resident care, increase staff satisfaction, and enhance the culture within the organization. What members may not know is that in addition to our recruitment services, we have also opened an education division, which we are very excited about. We are now offering a DOC and training program, as well as RN, LPN, and PSW leadership training, coaching, and support. These training programs have been developed and are facilitated by senior long-term care nursing leaders from our sector. Ultimately, we know that well-designed training programs don't just prepare leaders to succeed. However, it gives new leaders the tools to stay mentally and emotionally healthy while navigating the complexities of leadership.
Thank you, Heather. That is a fabulous overview of what your organization does. And I'm sort of sitting here thinking, oh my God, that would be helpful. That would be helpful. Oh my God. Okay. So Heather, a beautiful overview. Thank you so much.
You are so welcome, Denise. We are so, privileged and honored again to support this podcast. It's such an important topic, and obviously to support ACCA members.
Thank you again, Heather. Much appreciated.
Thank you.
Now I'd like to welcome our guest, Dr. Julia Kirkham, who will be joining me in this important discussion on mental health in long-term care. Dr. Kirkham's research focuses on improving geriatric mental health care, particularly access, equity, and safety. Her work on medication prescribing for persons with dementia includes studying the effects of antipsychotic deprescribing and mitigating unintended consequences. She also explores innovative approaches to treating depression in older adults, such as internet-based therapies. Now, let's begin our discussion on the national standards in long-term care homes. Dr. Kirkham, can you tell us about how your background in the field of continuing care, specifically your clinical and research interests, can you share sort of how you got to where you are today?
Sure, yeah. So I'm a geriatric psychiatrist, meaning I'm a specialist in psychiatry, and then I have an additional subspecialty or focus area, and additional training in working specifically with older people. And I'm originally from Saskatchewan, and I did a majority of my training there, but then I went for my subspecialty training in geriatrics to Ontario. And so I worked for several years in Ontario, both as a trainee and as a staff or full-fledged, so to speak, doctor, as well as a researcher there. And then I relatively recently came to Alberta in the middle of the pandemic in 2022 or 2020, apologies. And so my work is mainly in the community. I would see people who have mental health conditions who are older, usually over the age of 70, but a majority of my patients would be in their 80s. And I see people who have cognitive problems or dementia as well. And I work in many different settings, including in supported living and long-term care. And I've worked in long-term care across provinces, so including in Saskatchewan and Ontario, where my previous training is. And so my job is a little bit different than most doctors in that I'm also a researcher. So I more or less split my time between being in or doing clinical work, that means seeing patients, and doing research or related work. And my research focuses on improving the quality of care in places like long-term care and for older people or people with mental health conditions. And so some projects or areas of focus in my previous work is specifically on things like rates of antipsychotic use and how we can improve the safe use of medications in people in long-term care, how we can improve access to services. And then more recently, some of my work has focused on things like the quality of care for substance use disorders or the care for people who have neurodevelopmental disorders, things like intellectual disability as they age. So a lot of different areas, but I've specifically focused on medication use in long-term care for many years.
Well, Dr. Kirkham, thank you for joining Alberta and coming to
My
Alberta.
Thank you.
Your talents and skills and background are truly really important in working with the elderly, and the fact that you're a geriatric psychiatrist, thank you and kudos to that. So could you please share with us the need for national standards and how they were developed in long-term care homes?
Sure. So, and I didn't speak to my role in standard development, but as you know, I recently chaired the committee that developed the national standard for Canada for mental health and well-being in long-term care settings. And I worked with a large committee, so certainly wasn't the one who did all the work for that. That was a major effort, including public or stakeholder consultation and input. In any event, that standard was released in the past year, and it accompanies two other national standards in Canada that are relevant for long-term care, another one from CSA and the other from HSO. And CSA and HSO are standard development agencies in Canada.
And so,
In any event, sorry, go ahead.
so how do you think these relatively new standards will impact
Yeah.
long-term care in Alberta?
I mean, I think that is hard to say, remains to be seen. I can speak to what the goal for standards are. And so, that is what we hope to be the impact. But I think, could I predict that? Probably not. If you've worked in this area, and we've seen a lot of recommendations and reports and calls for action, and that does not always result in change. So, but the goal for standards is to provide some type of benchmark or goal for care, right?
Yep.
So a problem in Canada, and that was really, it was not new, but it was certainly highlighted by the COVID pandemic, is that there are very different care practices across Canada. Long-term care, every province has a provincial long-term care act and regulation, and everyone, there are some similarities, but everyone does things a little bit differently, and it makes it very hard to know in long-term care, what are best care practices, what's really the standard, exactly as it sounds. And it may be surprising, to learn that actually until recently we did not have any national standards for care. So many problems were highlighted in the COVID pandemic, and that led to renewed calls to try to work towards some type of standard or benchmarking for the type of care that happens in continuing care settings. And so, the goal for standards would be that these are best care practices, both based on evidence as well as, it's not just research evidence, because many areas we don't have research evidence, but, best care practices based on, consensus among stakeholders, based on other areas that we can, borrow from to know what is best, and so on, as well as, from clinical practice guidelines and evidence. And the goal would be eventually that this helps to make care across Canada in long-term care more consistent, and that some of these standards are incorporated into regulatory mechanisms, such as long-term care acts, either provincially or, the proposed long-term care act nationally, and other mechanisms such as accreditation. So standards are voluntary right now in Canada. There is no obligation to adopt them, but they help to guide this process, of, for example, incorporating some of these things into these mechanisms. And, it doesn't necessarily all need to be regulated. They also help to guide long-term care or supported living or other continuing care settings about, so if at an organizational level, what kind of care should you be aiming for? What should you be providing as a minimum?
Yep.
And, they help to guide the public and, care partners as well as residents in these settings about what they should be expecting. Prior to this, we did not have an idea of what that really looked like.
So it's wonderful that you've sort of got that national view. I think that's hugely important. And so when I reviewed the new standards, they appear to be a little bit more focused on safety and physical needs in long-term care. And I couldn't find any sort of areas related to the mental health needs of individuals in long-term care. Is that a fair review?
No. Have you reviewed the long-term care standard for mental health, the one that I was referring to?
No, I only reviewed the one that I think was more focused on safety and physical. So there's a specific one to mental health.
Yeah.
Okay, great.
Yeah. And these, the standard agencies work in parallel, you could say. And so I'm assuming the one that you're referring to is the HSO, long-term care services standard, and that, covers more sort of general care practices in long-term care. And it is more, I wouldn't say, it covers a lot more than physical health and safety, but things like staff well-being and culture and that type of thing are covered in that standard. And I would say that goes beyond kind of what the traditional focus on, safety. But that standard was developed knowing that there was a specific standard coming for mental health. And so there's a reason that mental health isn't covered in detail in that standard. It's because there is a complementary standard. I know it is an enormous topic, as you mentioned. There's a very, very significant proportion of people in these settings who have mental health conditions, particularly if we consider cognitive problems or dementia as a mental health condition. And so knowing that, this topic was so broad, it had a need for its own specific standard. And that standard was developed by CSA subsequent to the HSO one. It covers only mental health and well-being of long-term care or assisted living residents. And that's an important distinction. The CSA Z 2004 standard, the one that I'm speaking to, the mental health standard, is the only one that includes assisted living settings as well as long-term care settings.
Okay. And so how do you envision, because both documents are extremely important, but just to hone in on the mental health piece, how do we sort of get some momentum to impact and support continuing care in Alberta, knowing that those standards are probably extremely well written, addressing all aspects of what's important to a resident in continuing care? How do we get the momentum to kind of implement?
Yeah, good question.
Yeah.
Not totally sure that I have the answer because it's like such a challenging topic, and as we've seen before, there's been this push in the past, and things have fizzled or not resulted in real change. At times there has been really meaningful change, but I would say that standards provide a starting point or a tangible thing that we can speak to, at all levels when we're advocating for improvement in this sector. And I really do think that, implementing these is going to need to happen at multiple levels. And, there are responsibilities at all of those levels for improving care. So, of course, at a government or policy level, I think that in Alberta, for example, the ministries involved, being aware of these standards and considering them in things like accreditation or regulatory mechanisms, considering incorporating them as well as considering them with funding allocation. A lot of these things can be done without additional funding, but many of them would require additional funding. So that's important. And the standards provide like a point for advocating for specifics. Again, you're not just asking for additional money or additional regulation there. It's tied to, very specific and tangible areas of care processes. But, I don't think realistically we're going to improve care if we don't also have adoption at a, organizational or facility level. So people like directors of care, or when we're talking about private companies, running, some of our continuing care settings, the organizational leadership needs to be aware of these standards. If there isn't awareness and an effort to implement some of these or all of these standards at that level, I don't think realistically we would see meaningful change. So that's certainly important. And many of the standards either directly or indirectly involve changes in organizational culture. So obviously we need the, I would say, like, I'm using the word facility, but, home level uptake, for meaningful implementation. And then I do think it's important for people like care providers like myself to raise awareness about this, and about improving care and advocate for that. And for the public, if we don't have public momentum that continues to support change in long-term care, this is the thing that puts pressure on our politicians, right?
Absolutely.
And this is also, these are, when you know what care that you should be getting, when you demand better, this is really what can, push the needle. If we lose that, I think, that we're not going to be able to meaningfully, again, change or implement some of these standards.
So, Dr. Kirkham, can you share with us one of the standards in mental health that stands out to you that I think would be, as an example to the audience, something that is important related to mental health?
Sure, I can share a couple,
Okay.
that are, I would say, are quite important. It's hard to attach kind of importance to anyone, because I'm biased, but I do feel like they're all important. But I can give some examples to help people understand like what a mental health standard specifically looks like. But I'll speak also to something we highlight in the standard. It's not a standard itself, but it is a guiding principle behind the standard, and it's relevant to our conversation. It's very important, which is that we see mental health as existing along a continuum within this standard, meaning that the standard is not meant for people who have a mental health problem or condition. The standard is meant for everybody, because everybody is at risk of a mental health condition. And some people will come into a continuing care setting and they have a known condition, or they might develop a condition in that setting, or they might not, and your mental health and well-being is still important, even when you don't necessarily have a problem. So I want to make that distinction, because it is a guiding principle underlying this standard, and it's an important change or paradigm shift that needs to happen in continuing care, where historically, we have seen physical safety, or well-being as the priority. Okay. But, we know that many people actually who live in these settings, I know from talking to my patients, like, actually, that's not what their priority is. Their priority is not necessarily falling, right? Which is what care providers tend to, prioritize preventing, but it's having a good quality of life. It's being content, right? Anyways, and so I think, there's a major shift that needs to happen in how we think about mental health, and that it's not sort of exclusively this thing, for people who have a problem, but that it's important for everybody. It is an actual right for everybody, including in these settings, and it needs to be a priority, both for those people who have conditions or at risk of developing a condition, as well as for people who do not have any problem per se. And we see a continuum of mental health, meaning that people, at any point can move along that continuum, from being, in a good state of mental health and well-being to being in a, poor state of mental health and well-being, or with a problem. So I think, that's an important aspect of the standard to point out, although it isn't a standard per se. The specific standards that would, support the mental health that I discussed and well-being is, for example, that mental health should be included in all care plans.
Nice.
So we in residents in these settings would have a care plan, and that would rarely include specific, mental health considerations unless they had a psychiatric problem. And so, the standards speak to incorporating mental health within resident care plans. So how do we support a resident's mental health specifically, within the care plan, and that's regularly reviewed and adjusted. Other standards speak specifically to staff training. So a significant issue in continuing care when it comes to mental health is that staff lack training in mental health. And so one of the standards speaks to all, long or continuing care staff having some training in mental health. And then also, that some staff have specialized training, or additional training, and that these settings are more able to meet specialized needs without relying on other resources. Although we do have standards that speak to having access to specialized resources as well. So give a couple of examples. The standard is broadly, divided into things like organizational culture, staff training is incorporated throughout, care for younger persons in these settings, or care for specific populations like people who do have a psychiatric condition or diagnosis. And within that, there are very specific recommendations, such as the one I just spoke to.
Fabulous. Thank you so much, Dr. Kirkham. Thank you for joining us today and for your commitment to advancing care in this vital area. Conversations like these are critical to shaping the future of long-term care, and we are so grateful for your time. To our listeners, remember to follow ACCA on your favorite platform so you don't miss the next episode, where Dr. Kirkham and I will continue our discussion on mental health, this time focusing on mental health and medications in long-term care homes. If you're listening on Spotify or Apple Podcasts, we'd love to hear from you in terms of your feedback. Leave us a review, help us reach out to more listeners, and share these important conversations. Thank you for tuning in to the Long-Term Forecast. We'll see you next time.